Hello and welcome to 𝗛𝗲𝗊𝗶𝗶𝗃 podcast. In today's episode, we're going to be discussing an important topic that holds relevance to almost all parents, the topic of childhood hearing loss. And we're going to touch upon the audiology services that are available with us here at City Hospital to tackle this concern. Joining us in the conversation is none other, our ENT consultant, head of department at City Hospital. Welcome, doctor.
Thank you very much. Assalamu alaikum. My name is Dr. Abdul Aleem. I've been working at Mediclinic City Hospital for now 15 years. We are very lucky that we got an excellent department to provide comprehensive care as far as pediatric and adult ear, nose and throat and neck related problems, especially thyroid and parathyroid and parotid gland. Pediatric practice, we provide comprehensive services for hearing assessment and other childhood disease, ENT disease related problems like enlarged tonsils and adenoid, which can have an impact on the hearing. Any given society, important thing is that one should detect the hearing as soon as possible. So having this program of at birth hearing assessment, it's a quick pass and fail test. It can pick up a lot of cases of hereditary hearing problems. The advantage, if you catch these cases earlier, you can plan out the rehabilitation program as early as possible. You will have enough time to make patient and parents understand, because a lot of parents are in denial.
Absolutely.
It's very understandable.
It's a sensitive
for your
topic.
child. It's a very sensitive, emotionally charged topic. So you have a lot of time before you actively involve in the treatment, time to prepare them actually to what to expect and what sort of treatment is available. In this regard, we have an excellent audiologist, a pair of audiologists who are there to help the parents and make them understand what is the problem and how the problem can be solved.
We will definitely come into that in more detail in a second. But first of all, doctor, if you can just give us an overview, how does childhood hearing loss impact the kids, and how does detecting it impact the outcome?
So your hearing helps you in forming your speech, basically. So once you have enough data, you start speaking. Right? Now, if you cannot hear, you won't be able to speak. That's the most important thing. Early diagnosis helps us in basically making parents understand the problem, because a lot of parents, they start signing the gesticulation, which have a heavy impact on child development. Parents should be more verbal, a normal way of talking, rather than signing, especially with those who are having moderate to severe hearing loss, even profound hearing loss. So they basically are going in different direction of sign language rather than coming to the hearing world, basically.
So, doctor, I just wanted to ask you a question in terms of what you were talking about earlier. So how can parents actually pick up the signs of hearing loss?
In the first few months of life, there is one reflex, which is a natural reflex called startle reflex. Any bang around the child will result in child basically doing this, basically drawing. And that is a very sensitive sign that the child is hearing, basically. So most of the mothers are able to pick up this. And then later on, once the other milestones are developing, parents will know if they don't have that much ambience noise level in the house, they can detect even mild hearing loss.
So what are the causes of pediatric hearing loss?
Either you are born with the hearing problem, all right, or you have certain diseases in the childhood, mostly what we call fluid in the middle ear. That's quite common, and that can have an impact on the hearing and speech. There are other causes as well, but they are rare. The common cause we deal with is basically either you have congenital at birth hearing loss, or you're dealing with condition like fluid in the middle ear.
So how do you diagnose these cases, doctor?
You diagnose, traditionally it was very difficult to assess hearing in children because there are two ways of assessing the hearing. One is called subjective and other is objective. Subjective way in detecting hearing is we place you in a booth, soundproof booth, put a headphone on you and give you this trigger. We give you sound and you respond. naturally a child up to the age of 4 to 5 years cannot go through this test because it requires understanding and responding to the sound signals in order to make an audiogram.
True.
So some clever scientists came up with the idea that any sound to the ear generate waves which are passing through the various pathways to the hearing center in the brain, and they timed it actually. So if you have a hearing problem, these waves will not be generated, and these waves will be delayed actually. It's called brainstem evoke response audiometry.
Amazing.
We do it either under sedation or under general anesthesia, and this is a pretty accurate test in assessing your hearing pathways. So you do not require active participation. So it's an objective test.
Amazing.
Yeah.
And what are the latest advances in treating pediatric hearing loss in that sense? So once it's diagnosed.
See, it all depends if you have a problem at the nerve level or you have the problem in the middle ear level. In the middle ear level, as I said earlier, the common problem is fluid in the middle ear. First, you treat it conservatively with nasal sprays and antihistamines. You try to find out the cause of fluid in the middle ear. The common cause is enlarged adenoid, which also causes snoring, mouth breathing, and restless sleep. So once you find the cause, you treat the cause and you treat the effect as well. We very simply drain the ear and put tubes which ventilate the middle ear, and these tubes are basically self-extruding. They come out after 6 months. So that's the easy bit. You treat the conductive hearing loss. As far as the nerve deafness is concerned, it depends if it is mild, moderate, severe, or profound. In case of profound, what we do basically, we have this cochlear implant system. So this hearing processor is a totally different system basically. Hearing processor is implanted basically into the inner ear, and we have a processor under the skin behind the ear, and the outside processor is attached to it. Initially, it was the hardware was quite heavy basically, but now it's been miniaturized and everything is behind the ear.
Amazing. And that could be done here at City Hospital.
Yes, it's quite available. It's available.
Amazing.
We have implantable hearing aid where child they have a hearing system, but they do not have the ear, congenital absence of ear basically. So you cannot hang the hearing aid. In that case, we implant the hearing aid under the skin, and the outer part attaches with magnet. So you don't need the ear basically. So it's directly attached by magnet to the processor inside, and you can hear that activates your hearing pathway basically.
Amazing.
Yeah.
So different types of solutions for different levels.
It all depends what is the exact problem, and there are solutions available. We're living in good times basically as far as the hearing is concerned.
How did normally pediatricians and audiologists team up in addressing these hearing loss concerns for patients?
See, it's very important. A good pediatrician can pick up the problem earlier, and then they can liaison with audiologists, because as I said, hearing assessment in pediatric population can be a challenge, and timely detection, timely intervention, timely detection can help us in excellent rehabilitation of the child.
Any tips or tricks that we could teach parents that could help with their children who are suffering from hearing loss at home?
See, the counseling is very important for the parents. A lot of parents, as I said earlier, are into denial. So you have to bring them out from denial. That may require several meetings. And I don't shy away from meeting several times with the parents to make them understand that A, there is a problem. B, how much is the problem? C, what's the solution? It is also important how they treat the child, basically. And they have a liaison with their school teachers. Rehabilitation, majority of these children can school mainstream in a mainstream system, and they can come up with, I've witnessed in my practice in 30 years, they can become a very functional member of any given society, basically.
You did mention parents are sometimes in denial at first. So any advice for them in handling this emotional situation?
Realism is very important. You need to be realistic, and you need to understand what to expect, basically. Don't expect miracles, but don't go into gloom phase. Be practical. and do not shy away from seeking help. We have a lot of help around. All you need to do is to find a proper portal for the help. That's very important. A lot of the parents are shying basically. They should participate in the forums, contact the audiologist, contact us. We are always there to help.
Do you feel there's some sort of stigma around this?
Absolutely. It was more before, less now. In elderly population, I see even though they are wearing glasses, when you tell them you need hearing aid, they just withdraw. And blindness is very challenging, basically, and it attracts a lot of sympathy from general population. Whereas hearing loss, people are ridiculed with hearing loss. They seclude themselves from they're sort of living in a cocoon, basically. It's very important to pull these elderly people out and make them understand. What we do basically in our department, we always tell them, see, you test drive the hearing aid, all right, for 2 weeks and see if it is helping you or not.
Exactly.
All right. If it is helping you, then go ahead. And trust me, a lot of elderly who come up with the stigma of hearing aid, who just instantly say that we are not going to wear the hearing aid, they start liking it because the television is more comfortable. The people around are not complaining it's a very loud television. Your communication with your friends, with your family is much more easier. So it's a matter of how you convince the patient and take away this stigma, this unnecessary stigma. I think media has a very important role to play there to basically explain this problem and try to reduce the stigma by making it more attractive. Hearing aid these days are so good, this digital hearing aid, they have a basically compatibility with the streaming devices, with your phone. You can adjust, if you don't want to listen to anything, you just switch off through your app basically. So it's a digital system is much more better. Previously, yes, it was the analog system where it used to be a lot of all the frequency was amplified simultaneously, so there was a noise problem. But these days you can play up with the frequencies. So that positive message should go in the society. Naturally, people are living long. We will pick up more and more hearing problem. And we live in a noisy world, more and more hearing problem. So if we basically tell the society that yes, there is a solution, like you have a solution for your vision issues, you have a solution for your hearing issues as well. And there should not be any stigma attached to it.
Perfect. Thank you so much for getting the message out there.
You're welcome.
So many valuable information from today's session.
You're welcome.
And thank you to everyone listening. Hopefully this was beneficial, and see you next time in another episode. Thank you for listening.
Thank you very much.